The opportunity today. I want to also lend a voice to what all is going on. I appreciate my colleague from Tennessee there talking about the supply chains. I completely agree with her there, but it's something that we are going to have to seriously look at as we get through this process. We have become too dependent, and I appreciate her efforts in that regard. I want to talk today. I know we've got a lot going on up here, and for those that are watching and the American people, you need to understand that while this gallery may be empty and this floor may be empty, there's a lot going on in the United States Senate right now. There is a lot happening to try to make sure that we save this economy, that we do those things necessary to try to make sure our businesses, our workers, our economy from all sectors is saved. And again, I want to go back to the things that you can do as Americans, and that is to stop the spread of this virus. Do those social distancing, do those things that we have talked about now for several weeks to try to get folks to do your part. Because we're trying to do our part, and we are doing this in an incredibly bipartisan effort. I think you will see a lot of things coming out of the Senate and out of the House along with the administration to try to make sure we do those things for Americans. Over the past few weeks, I have talked with countless business owners and local and state officials. I've heard from a lot of folks who are scared to death, working folks that are now at home. They're not telecommuting because their jobs are not like that. All of which are alarmed about where we are today, where we're going to be tomorrow and next week and over the coming weeks and even potentially months. Businesses are having to lay off folks. They're having to furlough workers, sending a surge of folks to the unemployment line. We have seen that in the last few days, which is something that as we were moving, we just thought we would not see. Small businesses like restaurants, Main Street retailers will go bankrupt if we're not careful. They're going to go bankrupt without customers as folks stay home and practice the social distancing that we know we have to do. And as states start enacting forced closures of schools and events, those businesses shutter, and hopefully it will only be a temporary shuttering. First and foremost, there are steps we can all take, again, to stop the spread of the virus and begin to get the economy on the right track. It is up to us individually. But in the meantime, we have got, as members of Congress and public officials across this country, from local county officials and city officials to the governors and state legislators and members of Congress, we've got to do all that we can to make sure that our businesses, and particularly the small businesses, which make up an overwhelming amount of business in the state of Alabama, in particular, can continue to meet payroll and keep workers paid so that they can continue to make their obligations. So that's where my proposal comes in, that I've talked to a number of colleagues. So in addition to providing the same kind of direct assistance payments that is being kicked around now, whether it's to checks or in some form or another that people are widely talking about right now, I'd also like to see a new fund that is created to quickly get cash into the hands of small businesses so they can make their payroll and not have to lay off workers. I'm calling this the Small Business Lifeline Fund. It would provide a no-interest bridge loan for up to 3 months to be paid back over 5 years with no interest. And now this is a work in progress, so there are even proposals to make sure that this loan can be forgiven in certain circumstances. It would be administered through the Small Business Administration, would offer loans up to 75% of a business's last 3 months of payroll, with no one employee receiving more than $5,000. Now, I want to repeat that because it would affect so many people in this country. It would offer loans up to 75% of a business's last 3 months of payroll, with no one employee receiving more than $5,000 per month. Now, this fund, the key is this, it would pass directly through the payroll companies. Payroll companies around this country are used by about 40% of American businesses. They mostly cater to the small businesses with fewer than 500 employees. The payroll companies are in the best position to do this because they have already got the infrastructure in place. They're a smart choice because they've got payroll history. They've got the employee data that makes this quick, it makes it efficient. It uses the infrastructure and the pipelines that already exist without having to go back and reinvent or create a new whole set of dynamics that may or may not work. We know the payroll company system in this country works. Again, 40% of folks use it. Now, this process would help to alleviate the strain on our unemployment program. It would be a seamless way to continue to pay workers while also ensuring that payroll taxes can continue to fund important programs like Medicare and Medicaid, Social Security. Now, I want you to think about this. What we're talking about doing is not just a one-time $1,000 check or a two-time $1,000 check. It's literally funding the payroll the way it exists, maybe only 75% of it. But people that are used to getting those payroll checks through a payroll processor have their taxes deducted, they have their Social Security deducted, they have their Medicaid and Medicare expenses deducted. Those things would still come in. It's just that we have created a fund from the federal government to do that. So part of what we're fronting comes straight back to the federal government. Now, I think as part of this, we'd also like to offer assistance to folks who are self-employed, who run or their micro businesses. According to IRS data in 2017, there were some 26 million sole proprietorships in the United States. That's a lot of folks who are out there working hard, hustling every day to make their businesses, their little piece of the American dream, successful. But they don't have the cash reserves to fall back on in times like these. We could carve out and make sure that they are taken care of in the short run. This is not the time, in my view, to shortchange the economy. This is not the time to send out just a check here and a check there, especially for those who are the most vulnerable to cataclysmic shocks that we have seen in recent weeks. We got to be bold. We got to be big. We need to act fast. We need to cut the bureaucracy, and that's why using these payroll companies makes so much sense. Now, again, I want to emphasize that this is only one piece of this overall puzzle. It doesn't cover everyone. It will not cover folks in the gig economy. It will not. We have to do other things to make sure unemployment insurance and other things are available to them in a similar fashion. But this is a big piece of this puzzle that can get money directly to folks. Their wages can get to folks. Their wages can get to them right now, so that if we also have to do things like forbearance on mortgages and rents, we don't have to do it across the board, because these folks will have the money to pay those mortgages, pay those rents, to help those businesses stay afloat as well. The ripple effect of doing something like this, I believe, would be enormous. With this small business lifeline fund, we can send a message to folks on Main Street, with the lifeblood of our communities. We can take this idea up, keep them afloat so they can get right back on track as soon as we can get things back to normal. Right now, they need us. They need us in Congress, they need us at the local level, and they need us at the state level. So I'm urge my colleagues to let's look at this very seriously. For this package that we are putting together, that hopefully we will get done in the next day, hopefully hours, so that we can all get back to our states and our families to do those things necessary. But keeping in mind that whatever we do this week, I think folks understand whatever we do in the next day or so is only going to be the next step. I mean, I don't want anybody who's listening to anything any of us say think that this is the end of it and we're just going to finish our work and go home. We're going to constantly have to monitor this. We don't know what the future holds in some aspects. So we will be back if necessary, or we will do things differently if necessary. Two other things I want to mention before I yield the floor. I've talked about this for my state for a long time, and that is the need for Medicaid expansion. Alabama is one of those few states, I think 14 or 15 states, that did not expand Medicaid. Now, as part of the package we're talking about increasing the federal government portion of that, adding additional Medicaid funds. But for those states like Alabama, we will get the extra benefits for sure, but we won't get as much as we should have because we haven't expanded Medicaid. Senator Warner and I have a bill, it's called the SAME Act, States Achieving Medicaid Expansion. It's not mandatory. It doesn't make the states that haven't achieved Medicaid expansion. It doesn't make them do that, but it gives them the same incentives that they had a number of years ago. So that in a state like Alabama, some 300,000 people could get access to Medicaid that do not have insurance right now, that can't get that, and wondering in our rural communities and everywhere in the state of Alabama, what in the world am I going to do if I catch this virus? Where am I going to go? Well, ultimately, our hospitals, our doctors, our safety nets that we're putting in part of this package, we're going to have to cover it anyway. We all know that. Sooner or later, we're going to have to cover it. So I would love to be able to see the SAME Act, the States Achieving Medicaid Expansion Act, get out there and be part of this package. Let states have the opportunity. It's a states' right issue. Not a single state would have to expand Medicaid if we pass this bill. But we at least let those local leaders decide for themselves whether it is time that we give this opportunity to so many of the people in our states that are caught in between Medicaid and a job in which they are eligible for health insurance benefits. It would be a quick, easy way to make sure we're doing our part, and I would urge that that be put in there. Finally, today has been today has been the day that I've heard from so many people where in our underserved communities in Alabama, the African American community, the poor communities in Alabama, where the preachers are calling, the mayors are calling. I've been on the phone all day because they are concerned. And it's not that they're concerned because they don't believe the state has them in mind, because I've talked to state officials in Alabama and there are plans. But the fact of the matter is we have still in this country across the 50 states, we don't have enough tests. We don't have enough personal protection equipment. My hospitals, my testing labs, everybody in Alabama is just like every other state. We're hurting. We need those supplies. We're giving the money. The states are doing a good job. But I want to make sure that in Alabama and across this country, we don't leave out the poorest of the poor. We don't leave out the underserved communities, that we don't just put testing facilities in the big urban areas at the mega churches or the big hospitals like I've got in Birmingham, which are awesome, but that we also make sure that we've got these clinics set up around the state, in the black belt of Alabama, in the poorest of Alabama counties where people can't drive an hour and a half or 2 hours to get a test. We've got to make sure that we spread this out, because this disease is going to spread out. This disease is not going to just be concentrated in our urban areas. It is going to continue to spread. And in these underserved areas in particular, families live together. Grandmothers take care of their grandchildren. The aunts and uncles take care of their nieces and nephews. And they're all there together. And we got to figure out a way to protect them. We got to figure out a way to get those tests to them and to make sure that they are treated just as if they are part of this urban areas that we have that have easier and ready access. You know, I want to end where I've talked the other day and where I've ended so many of my talks, and that is back to the people in Alabama and the American people. I can assure you we're doing a lot up here. I see my friend from Alaska who is presiding today. I know she has been working. I've watched her back here working on the phones, talking to different people. Everywhere I go, when I do see senators, and most of us are doing things by phone and doing things remotely, everybody is working the phones back to their state to make sure that we do the right things. But at the end of the day, this is about you. This is about the people of America, because everyone in this country, everyone, to use a phrase from the old civil rights days in Birmingham, Alabama, everyone is a foot soldier in this movement. Everyone can do their part. We can put money, we can appropriate money, we can designate, we can give tax breaks, we can do those things necessary that we as a federal government can do, but we can't stop the spread of this virus. A U.S. senator cannot stop the spread of this virus. We can only stop it among ourselves. We can't stop it across this country. Only you can do that. Only the foot soldiers in America, the hundreds of millions of people that we got in this country, can stop the spread of the virus by heeding the warnings and doing the things necessary with social distancing and washing your hands. My hands are about raw. I've washed them so much. We are the foot soldiers. You are the foot soldiers. You can stop the spread. And you know, the other day when I was here on the floor, I pulled out a picture of my old friend from my childhood, Smokey the Bear, talking about only you can prevent forest fires, and talked about the fact that the coronavirus, the COVID-19 virus, is a forest fire across the country, and you can help stop the spread. Today, I want to be a little bit more patriotic about it. I want to invoke, one of my heroes who used this desk at one point, John F. Kennedy. It was John F. Kennedy 59 years ago, when he was sworn in as President of the United States, uttered the famous word that sent such an emotion throughout America, that really got so many in this country patriotic, standing up for what we do, when he said, ask not what your country can do for you, but what you can do for your country. That's what every American has to ask themselves today. What can I do for my country? It's not like days where we've got a tornado that's ripped through and you can go out and get a chainsaw and help your neighbor. It's not like days where a hurricane has come through and you can go get bottles of water and diapers and send to folks. What you can do for your country today is to stop the spread of this virus. What you can do for your country is to try to stay home as much as you can, to social distance and work those things. That's what you can do for your country. And if you do that, yes, businesses are going to have problems. We know it. That's what we're trying to work on, to make sure we provide that safety net, that we provide the necessary tools so that if we can blunt that curve and we can get past this, then we will come back even stronger. But to get there, we've got to have you. We've got to have you standing up and speaking out to everyone to do your part, to do those things necessary to make sure you do for your country what you should be doing, and help everyone in this country, help everyone around you. And when we do that, we will blunt this curve, we will make this as least severe as possible, and we will move forward stronger and better, because at the end of the day, we're the United States of America. Madam President, I yield.